Let's be honest, healthcare in Singapore isn't cheap, and if you've ever had to deal with a hospital bill, you know how it can rack up fast. That's why MediShield Life is such a big deal. It's a basic health insurance that every Singaporean and permanent resident has. But do you know actually what it covers or what it doesn't? In this video, I'm going to break it all down for you. Hi, I'm Fer from Dollar Bureau, a personal finance platform that talks about insurance, investments, and financial planning. So let's start with the basics. What is MediShield Life? At its core, MediShield Life is a basic health insurance plan run by the government. It's designed to help you with big medical bills. So think about your hospitalizations, your surgery, or long-term outpatient treatments like dialysis or cancer therapy. It's not meant to cover everything, but it gives you a strong foundation to help protect your finances when things get serious. And here's what's great, it actually covers you for life. Okay, who is eligible for MediShield Life? The answer is simple. If you are a Singapore citizen or a PR, you are already automatically enrolled. There's no need for application forms, no activation needed, automatic and mandatory. Even if you develop chronic illnesses or have a pre-existing condition before it started, you are still in. The goal here with MediShield Life is universal coverage. No one gets left out, even if you had medical issues in the past. So, how does MediShield Life work and what can you claim? Let's break it down in a way that it's super easy to understand. If you are hospitalized or undergoing major outpatient treatment like chemotherapy or dialysis, MediShield Life helps cover the costs. But before the insurance kicks in, you'll need to pay a deductible. Think of it as your upfront costs before any claim payout begins. After that, you'll share a portion of the remaining bill. This is called co-insurance and it ensures that this system stays sustainable for everyone. Once that's done, MediShield Life steps in to cover the rest up to a yearly claim limit. Here's how this structure works. For the deductible, it's anywhere between $1.5 to $3,000 depending on your age and whether you're warded in a B2 or C-class hospital ward. For the co-insurance, 10% of the first $5,000, 5% for the next $5,000, and 3% for amounts beyond that is payable by you. For approved outpatient treatments, it's a flat 10% co-insurance. The good news? You can actually tap into your MediSave account to cover your share, which helps preserves your cash savings. If you want to learn more about the MediSave, I covered it in a previous video and I'll link it in the description down below, so be sure to check it out. So one of the most common questions asked is how much can I claim with MediShield Life? And the answer is $150,000 per policy year. There's also no lifetime cap, which offers long-term peace of mind. But remember, it's not unlimited. If your bill goes beyond the annual cap or if the treatment isn't covered, you'll have to pay the rest out of pocket or rely on an integrated shield plan if you have one. So while it's not full coverage, MediShield Life helps to absorb the bulk of large hospital and treatment costs, especially if you stick to public hospitals. Now that we've looked at the claim structure, let's dive into the next key question. What does it actually cover? So what does MediShield Life cover? MediShield Life is mainly designed to support B2 and C-class wards in public hospitals. So if you're okay with the shared ward setting and the public healthcare system, which is pretty good, the coverage is actually pretty solid. Here's a snapshot of what's included, so be sure to pause to read. And here's what's covered for major outpatient treatments. That's a decent level of protection, especially when you're facing serious medical conditions. Now, here's something really important when it comes to cancer coverage under the MediShield Life and even your integrated shield plans. Since 1st September 2022, only cancer drug treatments that are listed on the MOH Cancer Drug List, also known as the CDL, are claimable under MediShield Life. That means that if the drug isn't on the approved list, it's not covered even if your doctor prescribes it and even if you have an integrated shield plan. This change was introduced to manage healthcare costs and ensure access to cost-effective treatments. But it also means that some newer or brand-name cancer drugs might be unclaimable unless they are on the list. So if you or a loved one is undergoing cancer treatment, it's a good idea to check whether the prescribed drug is on the CDL. You should also talk to your doctor or insurer if you are unsure whether it's covered. Next, you can also consider additional critical illness insurance or cancer plans for wider coverage. Now, what happens if you already have health issues before MediShield Life starts covering you? Well, if you had pre-existing medical conditions previously, then MediShield Life is pretty good. MediShield Life does cover pre-existing medical conditions. Unlike private insurers who might reject you or charge extra premiums, MediShield Life covers you no matter what. So even if you've had diabetes, heart issues, or even HIV before getting covered, you're still protected. This makes it one of the most accessible and inclusive insurance schemes out there. But what does MediShield Life exclude? Now, while MediShield Life is helpful, it's important to know what it doesn't cover. You don't want to be surprised later, so here are a few things that it generally excludes. Number one is ambulance services. You'll have to pay for that out of pocket. Number two are medical reports. If you need one for work or insurance, that is not included. Number three are maternity related costs. So things such as prenatal and postnatal care aren't covered. And number four is routine dental work, such as cosmetic surgery and general checkups are generally not allowed. Okay, I've covered the main gist of MediShield Life. Let's now talk about how much MediShield Life premiums cost. Premiums vary by age and they're automatically deducted from your MediSave, so most people don't feel it directly. Here's just a rough overview of how much you might be paying for MediShield Life premiums before subsidies. So in your 20s, it's around $250 per year. If you are in your 40s and 50s, that's between $500 to $800 per year. And if you are in your 70s and above, it starts at about 1.2k and could go up to 2.5k a year. Sounds like a lot? Don't worry, government subsidies help make it affordable. Lower and middle income households can get up to 50% off. And if you're part of the Pioneer or Merdeka generation, there are extra subsidies that cover up to 60% of your premiums. So, for most people, the cost ends up being very manageable. Even when you can't afford premiums, there are schemes like the additional premium support and the MediFund, which I'll cover more in another video. So be sure to subscribe and hit the bell notification icon. Okay, now comes the most important part, which is how to claim from your MediShield Life. The claims process is actually pretty straightforward, and most of the work is done for you. Just let the hospital or the clinic staff know that you want to use your MediShield Life, and the provider submits the claim on your behalf. CPF board then processes it and pays out the approved amount directly to the bill. And from there, you pay whatever that is left, either using your MediSave or cash. No need for forms, no need for fuss, and that's exactly how it should be. But here's the $1,000,000 question. Is MediShield Life alone enough? Short answer, it really depends on what you want. The MediShield Life benefits are packed to B2 and C class charges. If you are okay with public hospital care, shared wards and basic coverage, this might be enough. Actually, might be more than enough. But if you prefer somewhere more comfortable, such as A ward or a B1 wards, or want treatments in private hospitals, or you just want more complete coverage with fewer out-of-pocket costs, then you'll want to consider getting an integrated shield plan, also known as an IP. Okay, what's an integrated shield plan? They are basically a private insurance policy that sits on top of your MediShield Life. They expand your coverage to include private hospitals, higher ward classes, optional riders to reduce your out-of-pocket expenses even further. Now, there are currently 7 IP providers in Singapore, which includes AIA, Singlife, Prudential, Great Eastern, NTUC Income, HSBC Life, and Raffles Shield. I'll go through this in more detail in a future video. So if you haven't already, be sure to subscribe and hit the notification bell icon. And that's it, a full breakdown of MediShield Life and how it fits into your overall healthcare planning. To wrap it up, MediShield Life is essential. It gives everyone in Singapore a basic level of health coverage, but it has limitations as well, especially if you want more comfort or wider options. If you can afford to, adding an integrated shield plan can and will give you better protection and a peace of mind. If you're still unsure about what coverage is right for you, we work with licensed financial advisors who can help. There's a link in the description below where you can get a free consultation. No pressure, just guidance. If you've got questions about MediShield Life, IPs, or anything CPF related, drop them in the comments. I'd love to cover those in future videos. And if you found this helpful, don't forget to like, share, and subscribe for more real-world finance content made simple. Thanks for watching. I'll see you in the next video.